Good day to you. I am meeting you after some length of time to clarify a few things about some clips that are circulating and to bring in a new series I have begun on Life Beat. There's a clip that is circulating saying that postmortems were done on COVID patients in Russia. This clip came about 4-5 months ago saying postmortems were done COVID patients in Spain, and at one time there was a clip circulating saying postmortems were done in Italy. What they are claiming is that there's a bacterial infection. Some deny there's a virus, some don't deny there's a virus. The truth is this: when the COVID infection comes in, it comes in through the ACE2 receptors into the throat and upper respiratory tract receptors, and when the virus immune pathology begins, there is a immune ascending arm that attacks into inflammation, and there are specific pro-resolver molecules which are vitamin D dependent that decreases and arrests the unnecessary inflammation. That is why in COVID patients, when there's vitamin D deficiency, the inflammation that begins is not arrested and the patient can get bad. So it is good to have daily vitamin D supplements and zinc, of course. So what really happens is, once the immune pathological reaction, it's a pulmonary pathology, immune pathology, pulmonopathy. It is not ARDS like in COV1. It shouldn't be actually called a pneumonia. It is more pneumonitis. It's an immune inflammation. So in the alveolar capillary membrane, the alveolar capillary membrane is inside. If I may use this as a alveolus, here is the air coming in. Alveolar membrane is here, capillary is on this side. Let's imagine that this is the capillary is on this side here, capillary alveolus, here it is. So on this side is the alveolar surface where the air comes in, and on this side is the capillary and the capillary membrane, and in between the alveolar capillary membrane there is the immune attack, immune cell infiltration, and then thrombosis happens locally, meaning clotting in pulmonary capillaries, pulmonary venules, and the clotting begins, and that begins the cytokine reaction. Then that may spread further, and when there's a increased cytokine reaction, that sets off a process called disseminated intravascular coagulation, where interleukins, certain kinds of molecules, begin the same inflammation, immune inflammation, in other organs of the body, including the kidney, pancreas, and so on. So the new variant is supposed to be doing that more quickly than others, and with little fever, they are saying the lungs can be involved. Now what that clip is saying is that there is a bacterial infection. So people have recognized that secondary bacterial infection can be common because the COVID attack also depletes lymphocytes and neutrophils, WBC. So when the neutrophils are low, quite low, then it's a bad COVID attack, and that a bad cytokine reaction is going on. And in some people, even the platelets begin to drop. So the clotting mechanism that gets affected with the COVID infection can be only in the lung, or it may spread to other organs of the body as a disseminated intravascular coagulation, and doctors will check the D dimers, certain molecules, that is high. So now what they do is they give intravenous antibiotics to prevent any secondary bacterial infection. That is correct treatment. Now, earlier what India did was, as people were coming into the infection, even with early home therapy, they gave hydroxychloroquine and low dose aspirin to to reduce the viral multiplication, low dose aspirin to prevent the thrombotic phenomenon, which can be given in Sri Lanka also. Some centers do, some centers don't do. Low dose aspirin can prevent the thrombotic, that is the blood clotting process. So that is one thing. Then STOIC Oxford trial, STOIC Oxford trial has brought in the fact that well-known inhalator, that inhaler that is used for asthma, budesonide inhalation, which asthma people use. It's a corticosteroid basis thing. Budesonide inhalation can reduce the lung entry of the lung problem that COVID causes. So this every doctor ought to know, and there has to be general instruction given. If the patient is getting breathing difficulties, as soon as the patient gets breathing difficulty, they can be put on the budesonide inhaler, which asthmatics take, which is quite safe. Then of course by that time, usually even from a hotel, they will be transferred to a proper treatment center, either in the private sector or in the public sector, when the oxygen saturation goes down below 94%. So in all those treatment centers, they keep a close monitoring of the oxygen saturation level. Why is the oxygen saturation level going down? Because the problem in the lung is not a ventilation problem, but air diffusion problem. Oxygen can't get in and carbon dioxide cannot come out. So I will keep it at a layman's level. So don't get worried saying there are no ventilators, there are no ventilators. You need not get worried even there are no ICU beds. What you need is a bed with oxygen high flow, or a thing called CPAP, that is still available. We have not come to the stage of India where oxygen is not available. So don't panic unnecessarily. Then whether shutdown or not is an epidemiological, socio-political decision. So it's a very difficult thing to decide. But if you give this early home treatment with hydroxychloroquine and aspirin, vitamin D and zinc, or Australia has been extensively being given a triple therapy, suggested, innovated, researched by Professor Thomas Borody. He's the one who brought in the triple therapy for peptic ulcer, so he's a very well-known figure. So when he had done research, Monash University has done research, and they are recommending triple therapy, ivermectin, zinc, and an old antibiotic called doxycycline. Actually, it only needs one dose of ivermectin. It was a drug used for roundworms and so on. So it's a very safe drug in use from 1975, just like hydroxychloroquine, a very safe drug. But what happens is when cheap drugs are repurposed, the pharma industry gets onto it and does not allow a proper clinical trial to be done. And whatever empirical evidence is available in Bangladesh, they treated with ivermectin, and in other places, and they had good results. So in South Africa, frontline doctors have gone to courts and demanded the right to prescribe ivermectin. They have been given that right. In Sri Lanka, there is no problem about prescribing hydroxychloroquine or ivermectin. We are used to prescribing those drugs. Only thing, doctors have to be educated with the trial information that is available. So that's the present scenario and what I wanted to clarify. So regarding the clip that circulates about the post-mortem, it is true there are thrombotic phenomena, thrombosis in the lung that can go to other organs. It is true that intravenous antibiotics will prevent secondary bacterial infection. It is also true that according to the last Oxford trial, recovery trial, dexamethasone intravenous was also useful at a certain stage to prevent the overreaction. So the cytokine storm comes up, and that must be prevented by dexamethasone. But you must not suppress the other side, where there are interleukin molecules that are called specific pro-resolver molecules acting to prevent too much inflammation, if I may use the layman's language. So that's the interplay in drugs. I am Dr. Mendis. My last substantive official post was, as head of Department of Pharmacology in Calgary Medical Faculty. So my talks often has had more about pharmacology. Regarding the vaccine and its side effects, it's a very huge immunology controversy, and since it's not my primary training, I'm not going to discuss that. But I want to suggest to you a phenomenon in life. Here it is. Voice is calling. What is it saying? Make smooth in the desert a way. Everybody needs a way to go forward. So in my life beat 1, this is what I said. Let every trap waiting for you get unsprung. Out it goes. It doesn't trap you. And then let every crooked place go straight. There are crooked places that get into the lives of people. Maybe from a generation past, maybe from an inheritance, bad inheritance. It may be a work field that is a crooked place that you got involved in it. It may be a sexual deviation, it may be gambling, but it's a crooked place that needs to be set right. Then there are rough places that has to be made smooth. Those rough places have a way of rubbing on you. And in Sinhala you say, Hossalangi Masayana Ba, like Nidukumba you Pumbanava. So rough places are places that touches you on the wrong side. You say, don't touch me on the wrong side. So we need healing for that also. Then the rugged terrain, that is lots of rocky, ullul, sort of jagged places must be dealt with in our life. Then the low, muddy places where always there's mud and sludge and frustration and disappointment, that needs to be filled up. And then there are those mountainous places where we are very high and mighty, arrogant, tit for tat, that also has to be lowered. So then in the dry places, we need fountains springing up. So let me see whether you will understand this statement. And we need a good shepherd to help us in the rough places, in the thorny places, in our craggy places, in our low, muddy places, in our high and mighty, high-minded places where we give no say to anybody. We know always everything. When I'm on my timeline, I see some young doctors and even doctors who are specialists. They are so vitriolic in their comments. This is a time not for antagonists but for protagonists. We need to be on the side of who is doing something to help. Even we need to be even on the side of the government, in the sense that the government has to look after us. Good or bad or ugly, government has to look after us. You can't replace a government by Facebook politics and panchandrums. Yes. So we all need to work together. That is what protagonism means, work together. There's a relevance in pharmacology also. You have things called agonists. Then antagonists, all the time antagonism in your social media posts is helping nobody. It's not helping you either. So we need to move out of vitriol, bad mouthing, tit for tat, bitter words, and get into some shalom and peace. And my last clip was 178 in Sinhala, 177 in English. There I describe to you where the Good Shepherd leads us, the green pastures, the still waters, place of restoration, and paths of righteousness. That would be good life. But when adversity comes, when you have to walk through the valley of the shadow of death, then he has his rod, he has his staff, he has another way to take us through. So it is a good thing to know the Good Shepherd. And this passage describes it like this: wilderness and the desert will be glad. So COVID had made the world a real desert, wilderness. You don't know what is next, what trouble is next. Then the dry place, the crocus, that is where there were a lot of thorny places, blooms will come. Then it says, encourage the exhausted and strengthen the feeble. So these harsh words, arguments, gainsaying, debate, diatribe does not encourage the feeble. Lots of people are feeble. Even the rich, the wealthy and the famous catch COVID. Even in Sri Lanka, people are scared that oxygen may not be enough. So this is not a time for, you need, hear the word. Here this word, encourage the exhausted. Lots of people are exhausted. Even the medical profession is exhausted. Who knows, the government might be exhausted. So please, don't pour out your vitriol. Vitriol is the old word for sulfuric acid. Yeah, don't put it out. Yes. Then strengthen the feeble. You have to feel the feebleness. You have to feel the weakness to strengthen someone. Don't be so strong in your words and opinion. Yeah, opinions don't make any difference. It only locks your horns with someone else. And on a weekday, who knows, your horn may come out. Yeah. Say to those anxious of heart, take courage. Can you see what's exhausted? People are exhausted. People are feeble. People are anxious. Tell them, take courage. Fear not. People are fearful. Behold, we need help from our good shepherd. So those are the few things I wanted to tell you. Thank you for joining. I have discussed the present, the COVID pathology and the treatment that is possible. Share this clip with others. I will do this life beat thing hopefully every day. If you don't have, please get on to my timeline. Then our WhatsApp number is +94 77 49 59 214. I have an app that can be downloaded free. So if you don't have that app, send a WhatsApp to. It's called Golden Nuggets. At present, Android is there. In a few days, the Apple Store will have it. It's Golden Nuggets by Dr. Mendis. It's free to download. So please get a download. And if you want the link, please send a WhatsApp to +94 77 49 59 214. So we will meet again. Thank you for listening.